Welcome to this explainer. Over the last 50 years, the concept of health literacy has gone through an absolutely profound paradigm shift. We've evolved from a pretty narrow focus on just educating individual patients into a massive, global, systemic mandate that fundamentally shapes how we approach public health today. Let's dive right into how that transformation happened.
If we trace the timeline, you can see just how significantly this concept has expanded. Back in 1973, at the Saranac Lake Conference, our focus was extremely limited. We were basically just looking at health education inside school systems. But jump to 2004, and the Institute of Medicine shifted that focus directly into clinical healthcare settings. They emphasized that we need both foundational knowledge and actionable skills. Fast forward to today, and that idea has matured into a fully comprehensive, systemic approach driven by global health authorities.
Now, this expanding scope reveals a really critical transition in our public health strategy. We have essentially moved away from that classical, fact-based health education model. Instead, we now recognize health literacy as a multidimensional necessity. It's something that actively empowers entire populations to navigate what are, let's be honest, highly complex health environments.
So what was the real turning point here? It was recontextualizing how we view health literacy entirely. Historically, low health literacy was treated as a personal risk. It was this deficit-based model that focused strictly on disease prevention and screening for what patients didn't know. But the contemporary approach, it views health literacy as a massive asset. This fundamentally shifts our goal toward proactive health promotion. We're now focused on building interactive, skill-based competencies universally without stigmatizing individuals. All of this conceptual evolution really culminated in Christine Sørensen's definitive 2012 model. This model firmly expanded our framework way beyond just basic functional reading. Academically, health literacy is now defined through active competencies. It's the knowledge, the motivation, and the competence you need to actively access, understand, appraise, and apply information so you can make informed health choices every single day. And within this integrated framework, those four core competencies function dynamically together. The process of accessing, understanding, appraising, and applying information actually forms a lifelong cycle. It permanently links clinical healthcare interventions right to proactive health promotion. It seamlessly bridges disease prevention and wellness strategies across an individual's entire life course. It's brilliant, really. But this deeper understanding led us to a pretty major systemic realization. Just developing personal health literacy skills, it's simply not enough on its own. The modern standard demands what we call a dual-track approach. While we definitely need to keep educating individuals, organizations must simultaneously step up. They have to carry the burden of reducing systemic complexity, making their structures and services inherently intuitive and easy for the public to navigate. This dual mandate is exactly what gave birth to the concept of health literate organizations, or HLOs. And crucially, this extends the responsibility for clarity far beyond traditional hospital walls. To create a truly integrated ecosystem of accessible health information, we actually have to establish these health literate organizations within our educational systems, our workplaces, and our municipal communities.
We've come a very long way from treating patients as isolated learners to now holding entire systems accountable for public understanding. So, the ultimate question to leave you with is this: does the organization you operate within actively reduce complexity, or does it stand as a barrier to empowerment? Think about it. Thanks for joining me for this explainer.